Welcome to Marvel Path Lab. Today topic is about what is low blood pressure and hypertension. Low blood pressure or hypertension is most regularly defined as any reading lower than 90 and over 60 millimeters of mercury. A blood pressure reading lower than 90 millimeters of mercury, mmHg, for the top number, systolic, or 60 millimeters Hg for the bottom number, diastolic, is generally considered low blood pressure. The causes of low blood pressure can range from dehydration to serious medical disorders. It's important to find out what's causing your low blood pressure so that it can be treated. When low blood pressure causes problems, it can be a sign that not enough blood is getting to organ. If this happened too long, it can have serious consequences like shock, stroke, heart attack, kidney failure. Most people with this problem don't need medications, as there are plenty of natural ways that work like a charm. And today's video, we will tell you what they are. For some people, low blood pressure signals an underlying problem, especially when it drops suddenly or is accompanied by signs and symptoms such as dizziness can be a sign of a problem with your blood flow. Your brain needs a steady supply of oxygen-rich blood. Low blood pressure might seem desirable, and for some people, it causes no problems. However, for many people, abnormally low blood pressure, hypertension, can cause dizziness and fainting. Your eyes contain many tiny blood vessels. When subjected to the long-term effects of high blood pressure or hypertension, the following conditions can develop: blood vessel damage, retinopathy. A lack of blood flow to the retina leads to blurred vision or the complete loss of sight. Low blood pressure can cause fatigue, and some experts have suggested that chronic fatigue syndrome and low blood pressure may be linked. Extreme hypertension can result in this life-threatening condition. Signs and symptoms include confusion, especially in older people, cold, clammy, pale skin, rapid, shallow breathing, weak and rapid pulse. Blood pressure is a measurement of the pressure in your arteries during the active and resting phases of each heartbeat. Systolic pressure. The top number in a blood pressure reading is the amount of pressure your heart produces when pumping blood through your arteries to the rest of your body. Diastolic pressure. The bottom number in a blood pressure reading refers to the amount of pressure in your arteries when your heart is at rest between beats. Some medications can cause low blood pressure, including alpha blockers, such as prazosin, minipress, beta blockers, such as atenolol, tenormin, and propranolol, Inderal, Innopran XL, others. Drugs for Parkinson's disease, such as pramipexole, Mirapex, or those containing levodopa. Certain types of antidepressants, tricyclic antidepressants, including doxepin, Cylner, and imipramine, tofuranin. Drugs for erectile dysfunction, including sildenafil, Revatio, Viagra, or tadalafil, Adcirca, Alec, Shilis, particularly when taken with the heart medication nitroglycerin, nitrostat, others. Low blood pressure, hypertension, can occur in anyone, though certain types of low blood pressure are more common depending on your age or other factors. Age. Drops in blood pressure on standing or after eating occur primarily in adults older than 65. Neurally mediated hypertension primarily affects children and younger adults. Medications. People who take certain medications, for example, high blood pressure medications such as alpha blockers, have a greater risk of low blood pressure. Certain diseases, Parkinson's disease, diabetes, and some heart conditions put you at a greater risk of developing low blood pressure. Complications. Even moderate forms of low blood pressure can cause dizziness, weakness, fainting, and a risk of injury from falls. And severely low blood pressure can deprive your body of enough oxygen to carry out its functions, leading to damage to your heart and brain.